We are with CommonSpirit Health. We used to be a centralized registry. We were trying to figure out timing wise for us what was going to work as far as getting everybody into the new registry. All of them are TQIP designated, state designated as well too. So kind of looking at all of those nuances. We onboarded with Ray, and Ray was amazing. Definitely the teams were helpful in our success of that. I mean, knowing that we were early adopters of this system, we understood there were going to be some nuances. And we felt like we had some good communication. Definitely working with Ray, he was able to walk us through a lot of the issues. And that kind of led to that relationship, really kind of put us at ease. Then later on, Jenny came in once we transitioned to kind of the reporting side of it. And it was the teams and their communication that were essential to the success of our go live and a successful site review. So there's some nuances in working it out, but there's also some excitement about being in the introduction and having the ability to give feedback and the ability to say, hey, you know what, this would be better. We'd like to see it this way. And every site has different interpretations of how they do things. When we went into the new ESO system, we pretty much took it down to the bare bones. What are the absolute requirements for our submission? What do we absolutely have to have for our PRQ or for evaluation of the program? Like, we really went through and asked as we were building out our templates, do we know what this element is being used for? Do we know the why? And do we know how to put this in so that it meets the definitions? And so that was kind of probably a big piece of our success, was when we built that template out. It was very helpful. I think early on, we did get a early version of a data dictionary. And so that was very helpful to have something like that to say, is our interpretation the same as what their interpretation is? Definitely the key to success was open communication, and kind of putting together that data dictionary and understanding what everything was key to getting the information out. One of the successful reports for us was the patient selection reports. Looking for PI, I could reach out to Jenny and say, hey, I don't know how to do this. Can you help me with this? And they have site review. Jenny's there. What do you need? What do you need? And I was like, I got this. We had a very successful site review, no deficiencies, not even one. And they even gave us kudos for our interventional radiology, that nobody has interventional radiology times like we do. And that's probably because nobody's ever had those conversations with interventional radiology to say, show me your work. The query builder, it went a lot smoother. It was basically almost like a plug and drop. I was like, anybody on my team could do this because they don't have to create a high-tech query or anything like that. And so I pushed it out to my team that if you guys need to look for something, use this. I would say, it's been an amazing product. Definitely the resources have been very helpful within this. And definitely it is a customizable product. We really, as a trauma program itself, for us, we truly loved the customization of the PI module. That was a big thing for us. Being able to customize that, being able to make it unique for each facility, but still give everybody enough. And so it's really exciting to see all of the progress, the development, and I think you guys have amazing staff that definitely listen and want to find solutions to help the end customer.